Everybody in the world is trying to develop a new operation and a magic pill and all kinds of things. But at the end of the day, what percentage of the population can afford it?
हम करते हैं, आप चिंता नहीं करें। आप अपने हाथ में रखें। हम करते हैं, भगवान का दया से ठीक है, अच्छा होता है, चिंता नहीं करें। आप चिंता नहीं करें, भगवान का दया से अच्छा होता है। ऑपरेशन के बाद आप सब काम कर सकते हैं। ठीक? Our strength is that India is the only country in the world which can dissociate the healthcare from affluence. We will have a very interesting scenario where millions and millions of people living in the slums with no running water, no toilet, but they will have access to high-tech healthcare with dignity. That will happen because India produces the largest number of doctors in the world, nurses in the world, medical technicians in the world.
First time I heard about Dr. Shetty when I was in Bombay during my training in cardiac surgery. One of the senior surgeons there was telling there is one cranky heart surgeon in Bangalore. He is going to spoil all the cardiac surgeon's reputation because he is going to do heart surgery for 60,000 or less than 1 lakh. Because that time in Bombay, one bypass operation used to cost around 4 to 5 lakhs. So then I was thinking, who is this surgeon is going to spoil our reputation actually?
Can I see that ECG? Yeah. This is a small machine called trans-telephonic ECG machine. When you have villages in remote parts of the country where there is a doctor and a patient goes to him with a chest pain and the doctor doesn't know whether it's a heart attack. To know whether it's a heart attack, he needs to do an ECG. And with this machine, they can do the ECG. It costs 10,000 rupees. Okay, and that ECG to the telephone line comes here to our hospital. Irrespective of how far the village is, it can be 300 kilometers or 3,000 kilometers. It comes here instantaneously. Because if I don't need to operate on you, I don't need to touch you. If I don't need to touch you, you don't need to be here.
Can't come out of ventilator. Now he's on CPAP mode, but he always needs a minimal support. He always needs a minimal support. And doctors are very much doubtful how long he will maintain. So, sir, help us, sir. We need your help.
We have to just maintain these children as long as possible with intermittent support, with the belief that one day they will be able to breathe on their own. I'm sure by the grace of God, child will get better. That is a hope.
Sir, whatever support you can give from your end, please do it. Please take the time. That is our case. We will do everything we have to do. So please write any suggestions, your advices. Sir, please save us. Please save our little soul, sir. Save the child, sir. He is my grandchild. Please.
I will do everything possible. Okay. Thank you. If I am doing a job in some other industry where I am dealing with the files and machines, I may not be able to enjoy that to the extent I am doing now. I am dealing with few hundred lives every day. And those lives are like mine and my family members. So how can you get tired and disgusted with something which is so dear to you?
This is the lungs, you can see that there's a small thin layer of tissue is there. First thing he taught us is relax and enjoy your surgery. He always tell you are making a good picture, you are drawing a picture. Relax and do well. Enjoy the work. If you are not enjoying the work, your ultimate result won't be anything.
Dear Dr. Kumar, thank you very much for your mail. Stop. I'm happy to note that you are finishing your training program and in the process of coming back to India. Stop. I strongly feel that as a young surgeon, you have a lot more opportunity to become a star in those cities and eventually come back to Bangalore. We don't generally advertise for jobs. We pick and choose doctors who we want them to join us. And when we get huge number of applications to be trained, especially as heart surgeons. They work for 16, 18 hours every day, and we don't look at whether it's a weekend or a Sunday or midnight. It's hard for them, hard for the family, but if they choose to be heart surgeons, they have to submit themselves to the profession. There is no two ways about it. We only have one life. In that life, we want to train as many surgeons as possible who will be 100 times better than us. They are very egoist. They are not like scientists, they are like artists. They have their own idiosyncrasies. But for whatever reason, we have stuck to each other for most of our life. In fact, we spend more time with our colleagues than with our own wife and children.
We have differences of opinion. We may not see eye to eye, but we walk hand in hand taking care of patients. I mean, this is where you not only find the right partner, but you also be the right partner. I celebrate with an attitude of gratitude to God above all anything else. And then, from the point of view at the human level, I think Dr. Shetty has given me the opportunity to do what I've done. To do over 20,000 heart operations during one's career is not something that is easy.
When I get scrubbed up for an operation, I may spend 4 hours or 6 hours, 8 hours at one go, and he's standing in front of me assisting for the operation. So when I'm operating, I initially talk about the operation, then they talk about life, I talk about something else. So over a period of time, it's very interesting, these young surgeons, when they are sitting in next room, talking to a patient, all of a sudden you get confused whether it's your voice.
Purified blood will come here and go to the...
Because the way they walk, the way they speak, and the way they carry out their life is exactly like ours. We have very rigid rules. I don't like anybody drinking. I don't like anybody smoking. And if any one of them does it, I detest it. And they know that. So it is not the question of training them as perfect surgeons. I want them to be perfect human beings. But this is the way I am. Take it or leave it. Karnataka state government, along with the cooperative society, launched this scheme, and we decided to keep the premium at 5 rupees because 5 rupees is the price of one packet of BD which the villagers smoke. So if you tell the villager that one day you don't smoke and give that money for your health insurance, we thought there is a low threshold. And the other carrot we dangle in front of them is for 5 rupees you can get a heart operation done.
ಯಶಸ್ವಿ ಕಾರ್ಡ್ ಮಾಡಿಸಿದ್ರಿಂದ ನನಗೆ ಆಪರೇಷನ್ ಮಾಡಿಸ್ಲಿಕ್ಕೆ ಆಯಿತು. ಸ್ವಂತ ದುಡ್ಡು ಇದು ಎಕ್ಸ್ಪೆಂಡಿಚರ್ ಮಾಡಿ ಮಾಡಿಸ್ಕೊಳ್ಳೋಕೆ ಆಗ್ತಿದ್ದಿಲ್ಲ. ಇದು ಎಲ್ಲ ರೈತರಿಗೂ ಅನುಕೂಲ. ದೇವಿ ಶೆಟ್ಟಿ ಅವರು ಅವರು ಒಬ್ಬರು ದೇವರಿದ್ದಂಗೆ. ಐ ಥಿಂಕ್ ಈಸ್ ಎ ಗಾಡ್.
In every business there is a pacemaker who changes the rules of the game. Then all the others will follow in that direction and it becomes a norm. We have the privilege of having an opportunity to experiment in new methodology. We have the resources. God has been kind to us in providing all these resources. So we constantly want to reinvent ourselves. এখানে কাট করেছি, আস্তে কিছুদিন লাগবে, 2 সপ্তাহ 3 সপ্তাহ লাগবে, পরে ঠিক হবে। No, this is a tiny, tiny fraction of what we want to do. We have not even scratched the surface. We believe that the entire delivery model of healthcare would change dramatically. And we believe that healthcare industry will be dominated by healthcare professionals from India all across the world.